Right, time being 6:05 p.m., I'd like to call the Board of Health meeting to order. All members are present. I'm going to pass over the Pledge of Allegiance for this meeting due to the fact that we're on Zoom, and move straight into the announcements from the Health Department. I will turn that over to Chris/Lindsay, whoever is taking over that for this evening.
I'm gonna just start by saying I wanted to give a shout out and a big thank you to Marty Golightly, who is left for greener pastures. And then I'm going to pass it over to Lindsay for worked very hard on putting together our update today. So Lindsay, it's all you.
All right, thank you. Thank you to Marty. We are deeply going to miss him and all his help that he provided to us in the town. We had a first big test distribution yesterday. That without the support of Plymouth County for providing the tests for our residents, Chris for coming in on Sunday, the police department, DPW, Suzanne over at the senior center, Leanne from the clerk's office for making it possible, providing staff, Melissa, Kevin, Mr. Riley, I'm forgetting people, Allison, Mr. Testa. There's a whole bunch of volunteers that helped yesterday that we could not have had yesterday run as smoothly and successfully as possible if it was not for you guys. The support that we got through yesterday's events, and I say events because we had 2 locations going at the same time to make sure that the residents had a smooth and very just easy process. I'm very proud of the teamwork that we had and how it all went. We do still have a lot of tests left over. So please spread the word to residents that if they need anything, please give us a call at the health department, and we are happy to set a place that's convenient for them to come get tests. Senior housing was given tests today for their residents. I know they have a little bit of some mobility issues, transportation issues. So we did take care of those residents today. As far as vaccinations, we are continuing our vaccine efforts. From October through December, we vaccinated just about 4 days a week. With the staffing changes, we have to shift that a little bit. We do have all 3 age categories and to offer. So Pfizer 5 to 11, Pfizer 12 and older, and also Moderna. With that being said, to continue offering the safest clinics as possible, I have made the decision, because I'm the one that is giving shots, that we're going to do them on different days. And so Tuesdays will be my Pfizer 12 and older days. Wednesdays are going to be Moderna 18 and older days. And then Thursdays I get to hang out with my little kids, Pfizer 5 to 11. There are QR codes scattered throughout Town Hall. I believe we have some at the library. If anyone picked up a test kit, the backside of the if you test positive, if you test negative, if you're symptomatic, little form we gave you yesterday had a QR code for people to sign up for vaccines. We are offering first dose, second dose, third dose if you're immunocompromised, boosters. We are waiting to hear. We got a couple calls today about 4th doses for immunocompromised. We cannot move forward with anything until DPH approves it. As soon as we get that approval, those appointments will open up as well. So use those links, please. Also with the anticipated, hopefully soon, approval, fingers crossed for me personally. I have a little one under 5. With the approval, hopefully, of 5 and under vaccine, we will shift our schedule to accommodate that age group as well. I know it came up a while ago. I am the nurse that gives the shots. I do have some volunteer nurses that come in and help who are all have PD backgrounds. I also have pediatric background in emergency medicine and allergy and immunotherapy. So I'm completely comfortable giving little ones vaccinations. And if anyone has been around me during the PD clinics, you know how excited I get on those days. So I love hanging out with my little kids and playing with them and making it as stress-free and just enjoyable as coming to get a vaccine could be. Just a quick reminder about the difference between isolation and quarantine. There's so much information. It's so confusing to everyone. And that is just part of a pandemic. A lot of information gets thrown at you. You're being expected to drink out of a fire hose and process everything you're being thrown. It's completely unrealistic for everyone to process everything and get it straight. I have sticky notes all over my desk. I have notes. I have guidelines and flow charts, and I do this every day. So for the average person, I don't expect anyone to remember it. That's why it's on our website, why we constantly send communication, why I constantly sound like a broken record. But isolation is if you test positive. Quarantine is if you've been exposed. Isolation's easy. Positive, you isolate. End of story. It doesn't matter the background. It doesn't matter anything like that. Quarantine, there's a lot of nuances and a lot of different rules. If you're symptomatic, if you're asymptomatic, vaccinated, under-vaccinated, not vaccinated, there's multiple different scenarios that are set up. The easiest way to figure out how best to handle an exposure for you, just give us a call. I like to think I'm fairly easy to chat with. If I can't get on the phone, Chris will take a message and I'll call you right back. Just a reminder for everyone, a positive test, someone who isolates, is a 10-day quarantine. Oh my goodness, please ignore that. A positive test is a 10-day infectious cycle. We flipped to this 5-day at home and then 5-day wearing a well-fitting mask because the science that we're learning from as we go through this pandemic shows us that you're most infectious for 5 days. But you are, an individual who tests positive, is still able to pass the virus on day 9 and on day 10. So it's important, if you're leaving isolation early, please wear that well-fitted mask through day 10. It's on day 11 that you can pop that off, go with friends out for lunch. Until then, hang home, go to work and come back. This is an all hands on deck. We still need everyone to really help. This is how, as much as everyone's sick of hearing me say it, how we get out of it. So it is a 10-day infectious period. And just because of, we were fine. And when I say we, I mean the medical community, the science community. I don't mean, specifically the Abington Health Department. I talk about we as a very broad term, but it was found that people weren't following the isolation rules because it was too hard. And the thought process became, if they can't follow it for 10 days, why would they follow it at all? And the hope is, with shortening it to make it a little bit more tolerable, we can keep people home for the most infectious part of their illness and then allow them to slowly get back into their usual routine. Again, wearing those well-fitting masks like the KN95, the N95 rather, I'm sorry. All right. Continuing on my push for masks, vaccination, boosters, they are our best tool against combating COVID-19. I know, everyone has their own opinions and that's fine, but we got to think of it as a Swiss cheese model. I think most of you have heard me talk about the Swiss cheese model before. One mitigation measure is okay. 2 mitigation measures is better. 3 is even better. And the more we can layer, the more protection we have. And something to remember is that public health, what we are all tasked with doing our due diligence and doing our best at promoting, isn't individual health. It is population level health. And so we have to remember that when we are talking about things that we have to do to keep everyone safe, it is the population level. It's even for me, it was a hard transition. I went from being, with my background, and I cared for the individual patient, and I had a very large understanding and a respect for population level because it had directly impacted me in the field I worked in prior to public health. But that's something that gets lost in the shuffle with when we talk about public health mitigation measures is, well, it doesn't work for me. we're trying to do it for everyone. And so that's something that we ask everyone to respect and to understand, that it's not necessarily just for your house and your family. It is for the entire population. The last thing I have to say is numbers. Again, I don't love single numbers. They don't tell a great story. They don't tell a whole picture. It's just one single piece to a puzzle, especially currently. We know that home testing is all the rage. We just spent yesterday on a Sunday distributing all of these home tests. All of the research that I can find shows that the active numbers that we talk about on an everyday basis is anywhere from 4 to 10 times underreported because of home tests. So when I say, currently Abington has 63 active cases, which is what our active number is today, that's only clinically run lab tests. That is, someone went to a Stop the Spread site, someone went to an urgent care, their primary care. That's not a home test. That's none of that. So all of these tests we're distributing, it's amazing. It's another level, another tool to help us stop the spread, but it doesn't give us an accurate reporting. We are very much underreporting tests at this point across the country. So when I talk about numbers, I do like to just go over that, we have to look at the whole picture. It's the test positivity rate. It's the number of cases over time. So for an example, from February 1st to February 7th so this past week, our cases have increased by 40, we've had 40 new cases, which is a stark comparison to January 1st to January 7th, when in that same time frame, that same 1 week, we increased 421 cases over the same amount of days. So it's really important that people don't just look on our Google sheet and look at the daily number and say, oh, we have 63 cases, yet we're fine. We could have 63 cases, but I've taken off a lot because they've met their 10-day isolation. We've pulled them off. But we've had, if you saw me in January, I looked like a drowned rat trying to keep up with tests and who was coming off and who was going on. Again, our test positivity rate, we're almost at 15 still. That's really high. It's better than it was. We were at 25, a little over 25. We held there for a few weeks, but 14 isn't anything to celebrate. It's still a very high number, and we're still getting a lot of positive tests when people are seeking tests at a lab setting. Again, the 14.6 doesn't include our home tests. So that's all I have for updates. As always, we have an open door. We're happy to take visits and calls. If anyone has questions, again, I have said it 1,000 times, I got into this to help educate. What I know doesn't do me any good if I keep it to myself. I will say it 1,000 times over. I love to share what I know, and I hope I can do it in a way that makes everyone feel comfortable and makes everyone know that I'm approachable. And I will have the conversation and we will talk about whatever you want to talk about, but let's have the conversation so we can get everything out and figure out where the truth lies in that conversation if it's something that you're not sure about. That's all I got.
Thank you, Chris, Lindsay. I have just 2 more things I want to share. First things first, I've been working with Abington Cam to provide like a 2-minute quick update every week. I have to do this week still, but starting last week, of our update of our numbers, current active cases, total cases, numbers coming off the spreadsheet, just to give them in a video format. So if you're looking on Abington Cam, hopefully the YouTube channel or on your television, those things should be reported there as well. And hopefully that's a helpful resource as well. Unrelated to COVID, I also wanted to thank Allison Sullivan for spearheading the Substance Abuse Coalition, starting to come back together. I meant to report on this last meeting, but I was having some car trouble, so I could not make it. But I attended the first meeting of our kind of revamped Abington Substance Abuse Coalition, and they are trying to get going again. So I'll be attending those meetings for the next few months at least until we get going and see where things go. So I just wanted to give a shout out to Allison and Alex Bazanson and everybody who's been a part of putting that together. Thank you. All right, so that is it for announcements. We're going to move on to our first agenda item, which is the regulation review for body art regulations. I did invite all of our body art establishments to attend this meeting tonight as well. I gave them the option to respond via email or a phone call or just show up to this meeting tonight. I haven't heard anything. I know we were expecting one person. I'm assuming maybe Zoom troubles. We've been trying to push off this regulation review until we had them here, but we're on meeting 4, I think, of that. It's probably appropriate to move forward. That being said, Christina, you've kind of put together the framework. I've unofficially handed this off to you. So if you want to take it from here, I'd be comfortable with that.
Yeah, let me do a share screen. So when I reference things, like everyone kind of knows what I'm looking at here. Bear with me a second. And I should be sharing screen and everyone should see like a grid. If someone can just confirm to me.
Yeah, looks good.
Okay. So what I kind of did was do like a draft of section 2. I've mentioned this before. We did have some board members that did vocalize things for the entire regulation, some comments that don't fit into section 2, so they're not here, but I do have the meeting minutes from there. What I would like to do, and I can go through this in a second, but just to go back to the workflow of this project is I'd like to move into reviewing the rest of the sections and putting together the draft edits. And also just invite the other board members as I go through that, either through like I can do email, do comments, we can come back, but I'd like to continue through the drafting of this so we can get through section 2 and then basically read phase 2. Phase 1 is the rough draft. I'd like to get to phase 2 where our entire department starts going through the draft and making changes. If somebody has on section 2 at this time something specific, I can certainly add here live, feedback. So let me be quiet here and see if anybody currently on the line has any kind of feedback for this specific part. Okay. So at this time, Andrew, I can see your mouth, but I can't hear you. Are you talking or muted or?
Sorry about that. Was ear piercing included in that? I think I seen you scroll down to it. You were asking about this screen right here to have any issues with it. Is that what you were asking?
This is section 2 for the definitions. So when you say ear piercing, there is like a body piercing section of that.
So Christina, the definitions that you had listed right at the beginning, those are the ones you were asking about, correct? The first second, are you planning on scrolling and going down and we talk about? I can do that again.
Yep, I can do that again. So
okay, I think that's just where some of the confusion is the ones that are up there right now are the ones that we're talking about until we scroll.
I see what you're saying. Okay, so yeah, if we want to go through these like again on a line item, we can go through items, and there's an item number here 1 through 8. So I would kind of ask the board to do is if you're talking about a section, you say, hey, listen, Christina, looking at item 4, it'll help like quickly locate it. And then there's a page number here for like the place in the actual regulation, and then the section that it's in, and then like the original content and the suggested modification. So for this first page, items 1 through 8.
I'd like to make just a comment on the first item on the body art is prevalent and popular. We wouldn't be regulating it if it wasn't prevalent or popular. So I disagree with the notion that it should be completely removed. Maybe some modification relative there too, but the whole reason we actually take a look at this is because it's a prevalent and or popular issue, and that's why we need to regulate it. So that'd just be my opinion on that.
Okay. What would you like to see it changed to?
I'm actually comfortable with the current wording, unless the rest of the board is not. But I'm comfortable with the current wording because I think it describes accurately why we would look at it in the first place.
Okay, and then I'll have to trust the meetings to kind of capture things in depth, but for our note taking and feedback, I'm going to try to be concise. All right. Any other feedback for items 1 through 8?
Yes, item number 6. The definition excludes piercing of the earlobe with pre-sterilized single-use stud and clasp system manufactured exclusively for ear piercings. I would like to change that definition to add in that getting your ears pierced at a tattoo shop and getting your ears pierced with this pre-sterilized single-use stud and clasp system should fall under the same rules.
Okay, let me very quickly, Andrew, just so I can kind of reference for our body art regulation for the definition section.
Mm-hmm.
We're looking at, and bear with me a second because I'm trying to navigate. So this is page 3.2. Boy, this is linked to the page. I think this got moved a bit around. So for the definitions itself, like the section will be what we're talking about, and then the regulations following it will kind of go into more detail. So for the definition, do you want to change to the definition itself of what body piercing includes as part of the regulation?
Yes, I think it should be all piercings, regardless of how it is done. A piercing is a piercing, in my opinion. I think it should all fall under the same definition, all fall under the same rules.
Does that kind of capture what you're saying? All piercings should be covered under the same rules without consideration of the body part?
Body part and method of piercing.
Okay. And I know this didn't wrap. Which I don't see. Wait, okay. Okay.
Just to add to that, if I may,
Mhm.
I would be hesitant to, I mean, I understand where Andrew's coming from. I don't necessarily disagree. I just would be hesitant to change the definition without knowing why they're separate items. So if they're related differently throughout the regulation, then that's what I'd want to look at before we decide to make any changes.
This is just capturing the drafts. So we all have access to the regulation. And I think on the spot, kind of looking for the justification might be a little more research, but
which is why I'm bringing it up, because I don't want us to just blindly decide on something without knowing the background.
Yep. So this is just the draft phase. This is just capturing, all feedback. Anything else? And by the way, if I'm putting something here and it's not the way you're saying it, you have to just kind of let me know. Okay, if we're okay with this, let me move on to the next sections, okay? And please know, part of our workflow is we are going to come back to this. So there's going to be another opportunity to go through definitions. Items 9 through 15, these are across pages 3, 2, and 4, and these are also sections. So I'll just kind of keep it up for a second for any feedback. And Aaron, as the chairman, let me know if I'm going too fast or too slow through this, okay?
If anybody speaks up on that matter, then I'll trust their judgment on that, but we should be, I think you're fine with speed.
So ear piercing and body piercing, I'm wondering if you should add that same recommendation on that one as you did on number 6, I think it was,
Kind of
to
like
all do the same thing on number 10, so that when the time comes, we've looked it over, we can combine 6 and 10 together in one definition.
okay. I know I'm kind of jumping around everyone, so thank you for your patience. Okay. So 10, we've just replicated the feedback. So it is like with item 6. And Aaron, I replicated your feedback on the same thing.
That's fine. I was going to have that suggestion anyways. Item 14, wasn't that something, so it's the hand pieces and piercers? Or isn't that something that we brought up? Marty was saying that piercers was correct.
Yes, but there was never a follow-up from the Department of Health on that topic.
All right. Can we just add that as a note to get that follow-up?
Okay. Does anyone want me to hold for a couple more minutes on this section? Kevin, I'm sorry, did you have something, sir?
I'm fine. You can keep moving.
Okay.
And while we're just moving here, if anybody would find it easier to look, I can pop in the chat the spreadsheet as well. So if you want to look and follow along individually.
Okay, items 16 through 21.
I have a recommendation for, oh, where did it just go? Number 17, the master practitioner. I would personally like to remove the 5 years experience in the field, as I feel like, somebody with 5 years and a day is considered a master practitioner in Abington, and he screws somebody up really bad. And, I don't know if I'm saying that'd be something for liability issues, but it's just, oh, the town of Abington Board of Health told me I'm a master practitioner now. I don't think we should go down that road of labeling who is a master practitioner. I personally don't know how we would go about adding that into a regulation on who can be a master practitioner or not, but I don't know enough to feel comfortable putting a number of just 5 years and that's it.
So the original recommendation I had fits in with what you're saying. And basically my recommendation is to remove the entire master practitioner item itself, Andrew. And then on page 17, well, former 17, the reg stuff has moved. Where it used to, of course it doesn't search, where it used to say master practitioner, when we get to that section, we would reword it to something else. I'm going to get off the actual reg. I didn't realize the pages had moved, so now my reference is a little off, such is life. But yep, so I think I understand your feedback and I agree with you, but that's neither here nor there. Okay, any other feedback?
I would be hesitant about removing that section, mainly because of if we're going to permit people to practice, I feel like there needs to be that standard, and we're now removing the standard of what a master practitioner is versus an apprentice or X, Y, and Z. I feel like that gives us enough of a baseline. So.
Okay. Standard used as a baseline. Does that kind of capture what you're saying, Aaron? Vocalizes hesitation, remove the definition. Okay.
That's fine.
Anything else, items 16 through 21? Okay, this is exciting. We're going to get through it though. 22 and 23, because 24 is a little bit cut off. 22, I believe our Department of Health gave feedback that this is still confusing. So I'm just going to enter that there. Health Department, sorry. And I agreed with it after I reread, but I didn't want to change it from what was presented without going through this process.
I'm wondering like single-use items, things like the ink cups. Yes, they're single use, but like I don't know if we should add like single person use. Did you get what I'm saying? It's single use. You're thinking use once and gone, and then with the new person, some of those things can be used over and over and over again on the same person, but only can be used for that one person. I don't know if we should reword that or.
How do I say it? I think you're multiple times, but on the same. I think you're vocalizing, Andrew, very similar to what the health department's feedback was as well.
Okay.
And that's kind of what my original intention for modifying was. Same thing. Like, I think all three of us just believe it needs to be reworded, but trying to figure out how to reword it is the next course of action. Okay. And everyone will be happy to know that I think 24 is our last one. It's just very big. And mostly it's because what was being referenced in our guide for the licensees is, and you know, for the health department, I mean, certainly feel free to weigh in on these. That guide was like updated. It's post what was referenced. So my recommendation was providing the new guidelines. And then,
I would say, if I may, now that we're at the end of the definitions here, I do want to express my concern for changing definitions as I have before. I'm not comfortable with doing that, but it seems to have been the will of the board previously to do so. So that's why we've been continuing to do it. I'm not particularly comfortable, and I'm a little hesitant for us to be changing a lot of things. So I'm still going to voice that concern. But again, we probably should go through the process and determine whether certain things do need to be changed or not. But definitions are the one part of this regulation that I feel should stick to that draft, that template the best as possible. So that's just my opinion on that.
And Aaron, there's no place in this current document for me to kind of capture your feedback on that. So I do.
That's fine. I feel like that's something, you know, I voiced, and I think everybody can get as a summary point, but just wanted to put that out there again. And I appreciate everyone taking.
No, I appreciate it. I just want to acknowledge what you're saying. I hear it, and your feedback is definitely valuable, as I believe our most experienced board member with the longest longevity on this. So just because I'm not typing it in, it's because of the logistics of this draft, not in response to your feedback, which I thank you for. And for being respectful. Okay, if we're done, we're done. For the next part of this, what I would like to do is continue through the rest of the sections as I've done now. If somebody wants to take a section instead of me kind of initiating it, I'm more than welcome to that. This is kind of like my pet project, and I'm spearheading it for that, but I also don't want to exclude anybody as we get along in the process. If someone says, hey, I cannot wait to look up universal precautions and make recommendations. So other than that, my plan is to get through the rest of it, share it with the rest of the board. And then the goal would be moving through the creation of the rough draft, meaning to actually put the changes in, and then as a board, hopefully go through and vote appropriately. Yes, we want to include this in the rough draft, or no, we don't, which I'll probably lean on you, Aaron, to kind of give some rational guidance on how we can do that. Okay.
Christina, thank you. Thank you for taking that over.
All right, I'm going to stop sharing. Thank you very much, everyone, for your patience through that very, very exciting regulation review.
All right. Anybody have any questions or anything they want to wrap up? on this topic?
I wanted to just add in, like, I'm honestly more interested in hearing from either practitioners or anybody from the public who has a interest in this and wants to change something, like what they have to recommend on this. So I wish that people had turned out tonight, but we can continue to have this conversation. And Aaron, if you don't mind continuing to offer that invitation to those members, and see if they can come to our next meeting.
Absolutely. And if anybody who is a practitioner in town is watching, please, give us your feedback. We could certainly use it. Contact us on the town website, or if you did get my email, please respond. It's super important. And if you'd like to come to our next meeting, let me know. Anybody else?
Yeah, just on that topic, one of the original intentions was to, when the entire draft is done, to put the changes into like the actual reg inside the spreadsheet and give it to the body art practitioners, those who are licensed, because that way they can look at it and have like a time period to review and give feedback in full. If we're not getting good response through email, when we get to that point, it might behoove us to hit print and like either hand deliver it or mail it as like just a way to ensure it's getting to those businesses, to really just try to like double check to make sure that they're informed, they have that time frame. So,
all right. Thank you, guys. We're going to move on to our next agenda item here. So we're moving into our new business. It's board member and audience conduct. I sent an email out to the entire board and our health department earlier today. It should have had the town government committee handbook, which for those of you that are at home, you can find that on abingtonma.gov under the Board of Selectmen's policies and procedures. So obviously, our health director, Marty Golightly, is no longer with us at the health department due to some conduct and issues that I think we would be wrong to not approach. So we're going to chat about that tonight. I'd like to use the government committee handbook as a guidance. It's really a appointed positions code of conduct, but elected positions, we should at least strive to do those things. So I'd like to at least go over it and make sure that we're all on the same page as to how we should act during our meetings so that we can keep the most professionalism and be the most efficient as possible. So before I get started, because I really am just going to run through and see if we can just chat about this. But is there anything in general before we go into any detail with something like that that anybody would like to bring up or discuss on this matter?
I think you should probably start, Aaron. Maybe going over.
I figured, but I wanted to open it up first. All right. So looking at section 7, if you guys are on that PDF, I can actually share it too. Probably is the best way. I forget share screen's a thing sometimes. I think that's in here. So looking at section 7, so the selectmen have given us this code of conduct, the charter, general bylaws, there are administrative code, and it binds us to adherence to those state laws that apply. As we have right here, Mass General Laws, Chapter 268A governs a lot of, I think there's 6 basic things in terms of like gifts and such that govern elected positions or special municipal employees, things like that, and appointed positions. But the rest of these things are just what the selectmen have kind of offered to our appointed positions to say, hey, this is how you're going to conduct yourselves or you won't be reappointed. I'd like for us to adopt this format or something of this going forward, just as, a board so that we can be as efficient as possible. So just kind of reading through a few of these things here. Member of any board, there we go. For any board, realize that our basic function is to make policy, not administer it. We do have staff members that administer our policy. We are part of a team and we should be well informed in carrying out our duties. Remember that we represent the entire community and we are elected in this scenario by means of unselfish service, not to benefit personally or politically. Making all decisions relative to individual appointments, we shall avoid political patronage by judging candidates on merit, and we will refuse to vote on any matter involving immediate family member. So just in terms of community responsibility, which I think is paramount, we are part of the community, we're serving the community. I want us to keep at least these things in mind as well. We have a responsibility to municipal administration. We endeavor to establish sound, clearly defined policies, recognize and support the administrative chain of command, and refuse to act on complaints as an individual outside of the administration, which is important. We are a body, and we also have staff that if there are complaints that come to us, it's not up to us just as individuals to investigate those. The town manager has full responsibility discharging their disposition solution. So we should direct any conflicts to the town manager. They should be solved in-house, and all legal questions to town council through the town manager as well. The selectmen, because we are an elected board, can only do so much to support some of the things that we may come across. That's why the town manager's office is a better avenue for that. So they do not have control over issues dealing with other elected officials or committees appointed by the town moderator. We have our relationships with other boards. Official legal meetings are binding. We cannot bind the board outside of these meetings. We don't make statements or promises of how we will vote that will come before the board. If we have an opportunity to hear the pros and cons, again, just sort of a courtesy sort of thing. Make decisions only after all the facts and questions have been presented and discussed. Uphold the intent of executive session and treat with respect the rights of all members' boards despite differences of opinion. This is especially important. We've struggled in a lot of ways, I think, to try and hear everybody out and have our discussions and before and making decisions after we've heard all of the discussions that needed to be had. So if we can keep these points in mind, I think it'll make for a lot more sound discussions moving forward, especially on more sensitive matters that may come up to us. See, prohibited conduct. And a lot of these things are listed in the ethics training that we do take. So not accepting employment which will impair impedance of judgment, don't accept engage in any business or activity which require him to disclose confidential information, which is gained by this position. I'm actually not going to finish going through these because they're all the ethics ones as before, but and you can read them online as well. So I read through them. I didn't really want to read through them as much as I did, but I guess what I'm getting at is that we have these things in place. They're there for appointed boards, and we should strive to follow them whether or not we are bound to them or not. It's just the most professional thing that we can do, and it's the right thing we should be doing for our community. And at least in my opinion, I'm happy to hear the rest of the board, but if the selectmen have put these policies in place and expect other town boards appointed by them to do it, I think it would be in our best interest to try and adhere to those things as well. All right, so I'll open up the floor to anybody else who would like to chat on this matter, but that is what I wanted to just bring to the table. As there's something already in place, we don't necessarily need to vote. That's what we're going to do, but it's there.
Aaron.
Yes.
I really appreciate you making this an agenda topic tonight, trying to bring some order to the board. One of the things I think that we need to address as a board is responsibility of the board versus responsibility of the Department of Health. I think there's consistently been some confusion in that, and we've always kind of leaned on Marty. I think now with Marty gone, I think we need to really think about making a clear representation of what the responsibility of the board is and what the responsibility of the health department administrators are, and making sure that that's black and white. I know that there's been a lot of confusion in the public with that. I've seen a lot of comments on Facebook talking about, what the Board of Health has done or hasn't done, and quite frankly, that just aren't true. Or making assumptions that because the health department did something, that's a reflection of the Board of Health, or that the Board of Health has some kind of oversight over the day-to-day administration of the health department. I think that those are things that we really need to clarify. I think especially in light of an election coming up, I think that we need to make some clear, paint a clear picture for everybody, including ourselves, of what the responsibilities are of the board and what the responsibilities are of the health department. That line is too gray and too murky.
Thank you, Melissa. And I think that's a great point. Our mission as the Board of Health is to protect, preserve, and promote the health and well-being of all Abington residents. And our mission is met through the enforcement of health codes, which is actually a health department function, not necessarily a Board of Health function, which we just discussed as prior, make policy, not administer it, and in regulations while promoting health and community. So the part of the mission to protect, preserve, and promote is, I think, what should be paramount in our decision-making. And I think that part of the confusion may even come from the fact that this mission does provide that gray area. So I think that's a great point. That's something I think we want to address, clarifying and defining that role a little bit more clearly of how the Board of Health works in Abington compared to the health department, because it's different in every community. Christina, did you have something you wanted to?
Yeah, so as opposed for the code of conduct, I'd like to personally see this board adhere to any feedback to the health department going through the town manager. I do not want to participate on any more public boards where any board members are directing that feedback about performance to the health department. It is not in accordance to our code of conduct. I feel that it has created a negative board environment, and it's honestly quite taken a lot of time away from our actual duties. If our duties are to make policy, I would like to see us focus on our duties, which is making policy, and leave things in the town manager's scope, that's the town manager, so that we can use our time for doing the role that we were elected to. So that is, I hope, in accordance with the handbook, but that's how I would like to see our meetings move forward in the future.
Thank you, Christina. Does anybody else have anything they want to add?
I just think, Aaron, anything that gives us a guideline and a baseline of how we communicate and treat one another and treat the health department, I think it's a good baseline for the Board of Health to move forward in a positive way.
Thank you, Kevin. Anybody else? No. All right. So I will just be asking in general that we try to adhere to that unofficially. I don't think we need to adopt that, but if we can at least keep in mind that that's the expectation for everybody else, that should reflect on us as well. I do want to take the time also to say, I am chair of this board, and my job is to make sure that we can run our meetings efficiently, and we need to be able to get through our business and not have disruptions and do it legally. So I will take the means necessary to do so. I think that's of primary importance, is that we need to get through our business and feel comfortable getting through our business. And that's going to be my primary focus as chair. And I'm going to continue to do that as long as I'm in this position. Okay. So with that being said, I think we can move on to our next agenda item. So discussion to return to in-person meetings. That was a requested agenda item. Right now, obviously, we're on Zoom. We moved here due to COVID. Numbers and things are starting to change and adjust, and it may be time to reevaluate. What is the board's opinion on that?
This was my agenda item request. I personally think that we can go back to in-person meetings. Numbers have gone down for 11 consecutive days, or I think weekend, not including weekends, but 11 consecutive inputs on that COVID number sheet. Cases have gone down. I know Lindsay said that's, kind of not up there, but they're going down. And other boards, I know the Board of Selectmen are meeting in person. I'm not sure about any other ones, but I would imagine that some of them are meeting in person, and I think we should follow suit with that.
I don't have any problem, Aaron, with going back to in person. I think I would leave it up to the discretion of the chair if he believes that the numbers are sufficiently gone down, in a week and a half when we have to post the agenda. I am fine with going back to in person if the numbers continue down over the next week and a half, and that you can make that judgment personally whether you think we can return safely to meeting in person.
Yeah, I agree with that as well. I mean, it's the chair's job to do the agenda. And honestly, that's one point of contact, working with the health department. If there's a need, then having all of us, it just seems sufficient. So yeah, I didn't think about it the way you put it, Kevin, but that makes a lot of sense to me.
Yeah, and I'm aware, this is obviously my decision to decide what we want to do. I just figured out a courtesy because it's about everyone's safety. We should have a discussion. I agree. I think that we are probably in 2 weeks, we'll probably look better than we do now, even so, hopefully, fingers crossed. And at that time, I would feel comfortable doing so. So I would say at this time, unless something changes, we could plan on being in person for next week, 2 weeks from now.
2 weeks. Okay.
Melissa, I didn't cut you out of the conversation or anything. Is there anything you wanted to add?
I was going to say, I think unless we're having a public hearing, I don't really think there's a reason to go back to in person. We can, especially with the audience conduct. I know you didn't spend a tremendous amount of time on that, but it ends up being particularly disruptive and we're not able to accomplish a lot. I think our last few meetings have been more productive because we're able to focus on the agenda and not deal with misconduct.
I think that's a valid point. And, there is some element of that, once the COVID numbers started to spike, we could go in virtual after the meeting on December 20th, where things did have to end early. I think it was a bit of a relief. I'm kind of hoping, we're starting to see some trends downward that we can, reboot and go back and hopefully things are a little bit better. And that's kind of where my perspective is. If the atmosphere and the environment, and I have no problem, putting this out here as chair, if the atmosphere and the environment we get there are just as toxic and just as hostile, we will turn virtual right away. Because I think just as much as COVID is a concern, that is also a safety concern for us too. And while we're capable of doing so, it's going to be what we're going to have to do to keep everyone completely safe on this board, because we need to be able to do our job without that threat constantly.
I think, again, that's why making an effort to clarify what our role is as the Board of Health and making people better understand that is particularly important. I think getting our minutes out there so people can look at the things that we do as a board. If people had the opportunity to visit our agendas and our minutes and be like, oh, that's what the Board of Health does. And that, that clarity of, no, we didn't have a say in what happened in the schools. No, we didn't have a say in whatever it is you think we had a say in. I think that's especially important of why we need to be better about getting our minutes posted on time and why our communication efforts need to be clearer. I remember at the beginning of this, when I first joined, we had the issue of, some miscommunication about whether or not we were holding a meeting and what that meeting was going to be about. And we need to be able to move away from some of that at the same time, because that's what kind of creates some of that tension from the public.
I will be, hopefully, I got to talk to the health department a little bit more about this, but the minute situation is going to have to change going forward anyways, because of, the health department staff is not able to take care of that for us anymore. It's not something they can offer. So we're going to have to adjust how we attack that anyways. And hopefully we can try to address some of that as we change that process too. So hopefully that's going to be some help moving forward, because I agree with your point entirely. That I think is one of the biggest pitfalls, not having those things available, and any other delay in our proceedings getting out to people, I could see causing those issues.
Aaron, I would like to say one more thing just about returning to in-person too. I do think, as you know, and having stated what I stated earlier, but also that, even if other boards are going back to in-person, that, we all know that we have a responsibility to set the example as well. So.
Agreed. Is there any further discussion on this item? We're gonna talk about COVID in a minute, so co-related things we can move to then. We're gonna talk about minutes, but if there's anything else. All right, so moving on to our next gen item, COVID-19. What I have it listed as COVID-19 safety measures. So obviously we have an advisory in place. It has been in place since when? January now, or December 6th. There we go. if there's any action the board would like to take relative to that, I'd be open to have the discussion now.
I think the positivity rate is still very high. And I think to Lindsay's point earlier that I think with all the home test kits and actually, the feds are mailing home test kits as well, that the numbers probably are artificially lower than what are actually being reported. So I think with that in mind, I don't think, again, an advisory is an advisory that just, informs the public that there is a public health risk out in the public, and that, that they should be wearing a mask in public places. And it's, again, an advisory. So I would stick with the advisory until our next meeting, keep it on the agenda like we have been, and adjust it as we see fit moving forward. I did see the schools, I believe, are going to be lifting their mask mandates on March 7th. I believe I just caught that today on the news. So, so I do think, obviously things are trending in the right direction, but I think for us, I would just keep it again with a high positivity rate. And I think the acknowledgement that there is an underreporting of test cases, that I think we should probably keep it for the next few weeks.
Thank you, Kevin. Melissa?
Is Lindsay still on?
Lindsay?
I am, yes.
Hi, Lindsay.
Hi.
Thanks for your great update. One of the things I was going to ask you in follow-up to that, can you share the context of the public health responsibility if this was some other virus that somebody tested positive for that's on your list of viruses that you have to keep track of, and just kind of take the conversation away from COVID for a minute and talk about that responsibility of the health department, please?
Yeah, absolutely. So it depends on what it is. There's a list of about 200 reportable illnesses that if someone goes to the hospital, the doctor, clinic, whatever, and is tested for, and it pops back as positive or results as positive, that by law has to get sent through the Massachusetts Viral Epidemiological Surveillance System. We know it as MAVEN, to the local jurisdiction. So when everyone gets calls from me for all of the reasons that people get calls from me, because it's not just COVID, it depends on the specific disease process or viral process that's happening. But it is that case investigation. It's the contact isolation, and it's then looking at the incubation period of the virus or illness that we're talking about, and then isolating the contacts for the appropriate length of time based on that incubation period. And it's the same exact process that we have now become very familiar with. We do it with any other highly infectious disease that is a reportable illness. We just take out the controversy that we have now learned to work around. So this is not a new process in public health. Like I said, public health is population level health. And if that means doing the uncomfortable thing to protect the population, then that is what the goal is the greater good for the greater number. And sometimes that means the inconveniencing of a few initially to stop a bigger problem from happening. I hope that, without getting into the specifics of every single reportable illness, that's kind of the broad stroke, kind of very wide description of what we do with reportable illnesses. But we would ask for locations of where you've been during the infectious period. Sometimes an example for TB, if we had a positive TB case, we could be looking back months for close contacts. It all depends on what is reported to us, but we look backwards and then we look forward on how to stop it and how to pull those people out of the mainstream, so they don't have the ability to continue exposing and then potentially infecting others. I hope that answered your question without getting into a lot of boring details.
Thank you, Lindsay. Yeah, I just wanted that kind of part of the context of this conversation about COVID-19 safety measures, because I think people are too caught up in the word COVID and what that has meant for everybody's lives, and kind of get back to the point and the role of the public health department and what you're charged to do. Thank you.
Yeah.
Christina, Andrew, do you guys have anything you want to add? Christina?
Yeah, I mean, maybe this isn't for this conversation, but if we do return to in-person meetings as the Board of Health, I do think it would be responsible for us to remove the part of the advisory that's recommending remote work. It's kind of like, how can you as a Board of Health recommend this as a best practice and not follow it yourself? So if we do choose to meet in person and continue, then when it comes time to that, I'll just say I'll probably be making that recommendation to change that part of the advisory.
I would actually like to make a motion that, before I make a motion, I'd like to preface this by saying we've been using 5% as our threshold to decide whether to do masking in general. For that reason, I'd like to make a motion that when the case positivity rate hits 5%, that we remove our masking advisory and replace it with a general public health advisory for COVID-19.
Second.
So I'm not going to repeat my own motion, but I have a second from Melissa, and I'll open the floor for discussion.
For discussion, can you go in a little bit more, like break it down just a little bit more granular for me?
Yeah, sure. So my motion here is that once our case positivity, or test positivity, I should say, goes down to 5% or lower, the minute it happens, we will rescind without a vote and replace with just a general public health COVID-19 advisory, rather than specifically masking. We've been using 5% as our threshold. I think that there are a lot of people that have mentioned before about, moving goalposts, and I understand that concern. We've been using 5% as our threshold, our limit. I think it should also be the number that we decide to take it off to.
I agree with that. I think that's, that is kind of a standard that we've used, the 5%. I think it's just, being consistent logic, and that if it does happen, in the meantime between a board meeting, then at that point in time, the folks at the Board of Health can, take the action necessary to pull back on the advisory and just a public health advisory. I agree with that motion.
Can you, for me, explain the?
Sure.
Oh, yeah, I think you muted halfway through that, Andrew.
You're muted, Andrew.
Can you explain the difference to me from an advisory to a general health advisory or general public health advisory that you said? What would be the difference?
Sure. So the difference in my suggestion is, instead of saying we advise you to wear a mask, it's that there is COVID-19 and these are some safety measures you may take to protect yourself. So just a general advisory that COVID is there, because I think that that's part of our duty, that we still need to provide that education and notice.
For me, it's it's the same thing and just changing words. You know what I mean?
I would disagree that it's not the same thing, because the advisory is saying that because of heightened COVID-19 cases, you should be wearing a mask. That's the advisory. But, it's a best practice. That's what we're advising, rather than in general, hey, just so you know, COVID's going around. Here are some things you might consider, rather than, this is the thing you should do. I think it's a little bit broader. It's not restricted to a specific thing, which is, by the time we see that 5%, which is the threshold we've been using, I think we can start to lax specifically that masking is the only thing that we want to focus on.
An advisory, is telling the public that there is a heightened risk in the public place. Yeah. And if you're going out in the public, that, that there's a heightened risk that you would contract COVID, and that you should wear a mask.
Yeah, I think like last time, when we send out, if we're going to make that general advisory, we will send that out ahead of time. We can work on the wording. Send that out ahead of time amongst the board. We'll work on the wording and make it appropriate. So it's, it's more general, and just like we did before. But if that's helpful.
Yeah, I would definitely be for removing the word advisory from the top if we were going to be removing the fact that we're advising people to wear a mask and rolling it back to, hey, this is what you can do for it. I think we should strike that out from the top then. Yeah, it just,
I think for the sake of the piece of paper, I agree with you. We could probably reword that. Just for this motion, though, I'm calling it an advisory just because I don't have a better word. But I agree with that notion. I would not be opposed to wording it differently.
okay.
Yes, Christina.
So the only thing I'll point out is it kind of making sure we change the standards is important, but using a data point that's reliable, I think might be pretty difficult, because taking into consideration what our health department offered earlier about how our statistics aren't painting a realistic picture, I mean, I really am asking the question, is there a more accurate data point we could use? I'm not concerned about changing it based on percentage. I'm concerned about basing it specifically on the thing our health department told us today might, in my own words, not be very reliable.
I definitely want to allow the health department to answer that question. I will add that in the past, when I talked to Marty about, hey, when should we start to discuss this, there really isn't a good metric. And that's why when we started using 5%, it was the best metric we really had. And if that's the number we start with, I feel like that's also the number we should finish this with. If that's why we decided to do this in the first place, I don't think we should deviate from that, in my opinion. But I understand, I have always been an advocate of having that data-based decision-making, and I still want to do that. But I am just hesitant to start to change our definition of why we are doing it, because we used one data point before and now we're completely wrong, or X, Y, and Z, which I don't know. I'm just hesitant to start to change that criteria.
Well, the data point has changed, though. What that data point represents is no longer what it used to represent for our decision making. So it's not that we've changed our data point. The data point itself that we're relying on has changed. I guess what I would ask is to kind of consider this, and maybe this is a question for the health department. Since that data point no longer represents what it used to, is there something more accurate? And I know formerly we had Marty weigh in on this, but the reality is we have to depend on our current staff, I think, at this point.
Yep.
So
does the health department want to respond to that? Probably Lindsay, unless Chris wants to.
No, maybe no response is a response.
Yeah.
Can I chime in
will
on
say
that?
I agree. I think you've made a good point. I don't really have an emotion to amend my emotion, though. I think I want to stick with it as it stands, but I understand your perspective, and I think that we could at least take into account if we need to take any further action, in my opinion, that we might want to look at a different data point than 5%. But for this current situation, in my opinion.
All right. Well, thank you for considering. I appreciate it.
Can I chime in on that?
Yeah, absolutely.
So I think making an effort to show that we're looking at numbers regardless of how they've changed, at least we're doing the best we can, right? And I think to the point of getting the home testing kits out and allowing people to use those with their own freedom of taking that test and not feeling like they have to report might actually have people testing and taking more accountability for their individual health. So I don't think my daughter's trying to be part of this conversation right now. I apologize. I also think things have changed too, right? We have more vaccinations. People have their booster shots. Our kids are vaccinated now. So that also changes what that metric means as well. So I think things are constantly changing and moving, and the targets are constantly changing and moving. At least showing that we're paying attention to the numbers in the best that we possibly can, right? I think is important. So I agree with Aaron's motion.
Yeah, just to respond to that, those are a really good point, Melissa. And now that you've kind of offered that perspective on how things have changed, including the vaccination rate, or I'm sorry, the vaccination availability, that does actually kind of change how I'm looking at this. So I think those are really great points, and I thank you for sharing.
Do we have any other discussion on the motion on the floor? Hearing none, we are going to move on to a roll call vote. Just because we're virtual, it's what we have to do. I'm just going to start with kind of how it's formulated on here, so it's random. Andrew, how do you vote?
Yay.
Melissa? You were muted. I'm sorry.
Sorry, yes.
Thank you. Kevin,
Yes.
Christina,
Yes.
and I vote yes. The motion passes unanimously. So at 5%, that advisory will be replaced. Thank you, everybody, for working through that. I'm glad we were able to have that discussion and really kind of nail down a little bit where we're at with all the changes. So much appreciated. Our last agenda item is minutes. I want to point out that minutes were not sent to anybody because they are the same ones as before. There are still a lot of changes to be made, and I had made an effort to go through and update them, and they became very numerous, and I did not have access to the Word documents. So it became a little bit cumbersome, which is why I had not sent them out. I'd like to take this time, if possible, to go through them and maybe make a Word document and vote to approve that. Or we can try and push this off again. I'm not a fan of doing that because we're already at multiple months since these should have been approved. So it might take a little bit of time, but I think we need to get this done. I'm happy to screen share minutes if nobody has copies, or if we want to take another route to it, but we really should get through these.
I think we need to get through it to, get them posted and be in compliance.
Let's do it.
What is the compliance for time?
The open meeting law is 30 days, and we are at multiple months over because of staffing issues. So we need to get on top of that, which is why we're going to do this now. Apparently I did do updated versions, so I will screen share those. Actually, I apologize. I guess I did get through all of them. Give me 1 second to screen share. We can go through just kind of how we did with the definitions. We'll kind of just look and scroll.
I tend to object on this as it hasn't been sent out to us, and now on the fly I have to try to remember back however long to be like, oh wait, no, I said this instead of that. You know what I mean?
These are the same ones he's already asked us to look at, Andrew.
Yeah, the ones that I have that are updated right now are just wording in terms of who spoke and things like that. The content is exactly the same.
Okay.
So these should be exactly the same. And anything before November 15th, Andrew, you'll have to abstain anyway because you weren't here. So it's just looking back from the 15th on.
Okay.
Hopefully that just helps a little bit.
Can we possibly do from the 15th on first then?
Sure, that's fine. That's fine with me. I apologize. I'm just going to pull that up. Okay, 11:15. All right, and I will screen share that now. All right, so these are the minutes from the 15th of November. I'm just going to scroll to get at least one whole section in view here. And everyone, feel free to take a moment and read, and we can move on to the next section when everyone's ready. If I may add, I'm sorry, well, I know everyone's reading, announcements, things like that. I think the major focus should be making sure that the content of what the board voted on in particular, or the discussions, are most important. So, probably want to put the most emphasis on those when we get to them. Just make sure that that stuff is correct. And yeah, I'm going to start to scroll a little bit. Just scroll a little more.
Aaron, can I make a suggestion?
Sure.
On
Any
the-
way to do this better than we are is great, by the way. Just want to throw that out there.
So with the tobacco permits currently in Abington, one of the questions I had to Marty was, were we maxed out? And he said we were. And I would like that as part of the record that the town's at capacity.
Okay.
So however you want to phrase it, but it's just kind of a data point. As of this date, our town had maxed out all of our tobacco licenses. Thank you, sir.
Okay. Sorry about that. I actually, and looking back at this, I wanted to say I thought the number was 29. So if we could check on that too.
I think that's.
I'm going to start to scroll a little more. This is probably one of the longest ones, by the way, guys. So I apologize in advance.
Second edition, please, sir. Under the Pfeiffer proposes adding little cigars to regulation, Mr. Wilson explains the definition of cigars. The health department agent, Marty, would likely agree that that definition should be added.
I'm sorry, what section are you talking about there? Right here.
Mhm.
Yep.
Got it. Thank you.
Just for the record that at the time, the health department agreed that adding that to the regulation would make sense. I questioned the paragraph that says Mr. King asked if there was an uptick in sales after the flavor ban. Andrew, you might have to speak to this, but that doesn't seem like that makes sense. It seems like you would have asked if there was like a downtick after the ban. Because why would you be asking, hey, you banned flavor, did it uptick? I don't recall it. It just strikes me as odd. So kind of leave that one with you, Andrew.
My line of questioning for that is the way it is worded there, as some people that do the electronic cigarette couldn't get the flavored cigarette, the flavor in the vape juice that they wanted. And, it was, they were using it to quit smoking cigarettes, and they can't get the flavors that they liked. So now they just went back to cigarettes.
Oh, so it's the flavor ban of the e-cigarettes there, right?
Correct.
Okay, do you think we could add that for clarification? Because I know they banned like methanol cigarettes, which would be like the flavor of cigarettes. So could we add the flavor ban of would you call a vapor an e-cigarette? Is that the right?
Yes.
I think for terms of the regulation, it's e-cigarette anyways.
Okay.
That makes sense.
Yeah, that makes sense what Andrew's saying. Nothing else for myself.
Just at the very end, Aaron, it refers to Andrew as Mr. Andrew rather than Mr. King at the very end.
Yep. Another thing is the Christina, you did turn in body art regulations, suggested modifications. You turned that in to be added to the.
Yes, I sent it to the health department twice.
Okay. All right. We'll make sure that gets attached to the PDF next time. Well, at least when they get posted is what I meant.
Yes, please. Oh, it says see attached, so it must just be.
It's not attached to this PDF that was sent to us, so I'll just make sure that it's attached to the PDF.
Aaron, would it be easier, since you're doing it, if I just turned it into a PDF and just send it to you? And
Yeah,
then you
that'd be
could
great.
attach it?
Because then I can edit the PDF and add it in.
Yeah, let me do that so you can.
Okay, I'm
That's
going
what
to
we're around.
just scroll up here. If I go to a fee schedule, am I cutting anybody off?
No.
Because that should be right at the end there. And like I said, this is the longest one, so hopefully the next few are not as long.
I think this is the one where I wanted it added that I asked Marty specifically if he had any recommendations for the fee schedule, and he said no. I wanted that documented on the public record, please.
Sure.
Aaron, I recollect you tabling the discussion into a specific, oh, I apologize. Hold on a second. It says Mr. Whalen motions to table discussion.
Yeah,
I
that's
thought there was something on there about us agreeing to pick it up at a certain date, like at the beginning of 2022.
Yeah, there was a motion made by, I believe, me to table the discussion. Oh, no, you know what? No, Kevin did make the motion. I made the suggestion. So that's right, but until 2022.
Did we have like a beginning of 2022 or was it just 2022?
I think it was the first meeting in 2022. That was the date. So it would have been January 10th.
Well, I hate to be that guy, but I think we have to add it in.
Well, I'll tell you what, I'll go back and listen to the motion and make sure that it's just worded exactly as it was motioned.
And I'll trust your judgment on it. No follow-up needed. Thank you, sir.
Yeah, no problem. Sir, at the end here, any other suggestions or notes to make here? Hearing none, we can we'll move on to the next meeting. I believe is December 6th.
Andrew, do you want, I mean, Aaron, rather, do you wish to have like a motion to approve based on the changes or?
I figured that since we're going to have such a long list of changes that we could just say that they're all good to go, but
Right.
it might be wiser to do them one at a time. So
Okay.
I can read off the list of changes that I have, and if we want to approve them that way, that's probably a better way of doing that. So I have right now, looking at, so we're page 2 here. We'll have it noted that we maxed out on tobacco permits in town. The next thing was to include that that Marty made the suggestion about the little cigars. Following that, we have Andrew asking about the e-cigarette flavor ban and how that affected cigarette sales. Correct the Mr. Andrew to be Mr. King. And I also have Melissa wanted to have noted that recommendations for changes to the fee schedule, there were none. And then check the wording on this motion to table a discussion. Those are the changes that I have.
And adding the PDF, which I just.
Yeah, and adding the PDF, right.
And I just emailed that to you now, Aaron, so.
Great.
You should just be able to combine it or whatnot, but.
Yeah.
If you don't have PDF settings to do that, send it back to me and I'll put them together.
Yeah, no, I should be fine with that.
Oh, yeah,
make
you're
a-
not tonight.
Yeah, and I also, Health Department just noted to me that menthol, not methanol, is listed in there. We'll change that as well.
Oh, yeah, methanol cigarettes, that would be. That would go over well, would it?
All right, any other changes here or anything that I missed?
I'll make a motion to approve the minutes for November 15th as amended.
Second.
I have a motion to approve the minutes of November 15th as amended, and I have a second from Melissa. Any discussion? All in favor? Oh, we got to do a roll call vote. We can do a roll call. Andrew, how do you vote?
Yay.
Melissa?
Yes.
Kevin?
Yes.
Christina?
Yes.
And I vote yes. The minutes pass unanimously. All right. Okay, moving on to December 2nd. December 6th, I'm sorry.
6th.
Too many twos in the date. Okay, start here, I believe. This is similar in length, and then they get shorter.
You keep going, please.
Yep, please.
Thank you for being fast readers.
Keep moving.
Go ahead, please.
Yep, move.
Going to move to the next page. I just want to note this yellow here will be removed completely. It's just was stuck on the PDF. I couldn't remove it.
I think move forward.
Hold on a second. I apologize. The large paragraph that starts with Ms. Pfeiffer states that the letter, yada, yada, yada. The second sentence from the bottom, Ms. Pfeiffer asked if prior to the contamination levels being lowered, if Abington was complying. It wasn't the contamination levels being lowered, it was the contamination standard.
Okay.
And ready to move forward.
Yeah, I just want to note, I wrote down, this says Mr. Joe, it should be Mr. Lapointe.
Point, right.
There should be safety measures with this.
I'd like to make a comment on Jennifer Mccloud. I might be saying her last name right. I believe she also vocalized a concern about mental health being a public health issue. And she was specific that that was a public health duty, to my recollection, Aaron, that was a public health duty, that she was concerned. She expressed concern that our Board of Health wasn't doing enough for that.
I'll cross-check that with the
and just because it was
video
very
as well.
relevant to the board's actions and her, feedback to us as a board, not the health department.
I also like to comment that before Ms. Campbell spoke, I asked her address.
Am I all right to move?
Yep. Yes.
On the town training section in bold, I believe, Aaron, you and myself, we had a quick discussion about the Board of Health specific Facebook page had been brought down in compliance of legal counsel's recommendations. Like it was something I was proposing, but you had already done it before it even got to that point.
Right.
I believe
Right,
I made
yeah.
some comments on that as well.
Yeah. All right. So that discussion's not included. I'll include that as well.
On the Ms. Sullivan reiterates the hard work of Abington. I do believe that she disapproval of mask mandates. I don't believe it was as far as the advisory, though. My recollection was that it was just on the mask mandate.
If I'm not mistaken, I think so. She wanted the sunset clause on the advisory.
Right. That's
And that-
correct.
and- right. I guess I question the word disapproval to describe that.
Right.
I have to look at the meeting again to probably change that.
Yep.
And Aaron, I'm really just having a foggy moment. The chair recognizes Allison Sullivan, which I recall, but also Alex Haggerty. For the life of me, I remember Alex Haggerty being in the room. I don't recall him speaking to the board.
He declined the opportunity to speak.
Yeah, and if I may, I think it was Melissa that made the note that they were there. I didn't recognize them, but I allowed Allison to come up and speak.
I asked you to recognize Allison,
Right.
which you did.
Right. We'll amend that to reflect that better.
And if we could add some clarity, Allison spoke, I believe Alex, just to be clear about what his participation was.
Alex, yeah, you can put Melissa asked the chair to recognize Allison, and Alex, the chair did. Alex declined the opportunity to speak. Ms. Sullivan said.
Yeah.
How many minutes things are involving me left?
One.
Okay. I'm needing to bow out.
Yeah, if we have no other changes here, we can, I can read off these real quick and we can take a vote on that.
I do want to make a quick suggestion relative to Andrew leaving. I believe one of the earlier minutes, while Andrew wasn't a board member, I do believe one of the minutes was when Andrew spoke as a participant. So
Yes.
I don't know, Aaron, how we want to address that since he wasn't there, but.
I don't think that because he wasn't a board member, he can be included on that vote.
But can he be included in the discussion?
Yeah, he can be included in the discussion, absolutely. He would still have to abstain.
Right. So I guess what I'm saying is if he's got to leave and we're going to bring up minutes where he participated as an audience member, you know what I'm saying? Like, I don't want us to address that minutes and move forward without him being here, unless, Andrew, you don't care. I'm just trying to be here.
My whole thing is that what you said about Jennifer Mccloud, if she came here and wanted to address what she spoke, would we realistically, would you guys allow her to get involved in that? You understand what I'm saying? It's this thing. I wasn't a board member back then.
Okay.
Right.
And I think Andrew makes a good point. We wouldn't expect to go back and ask people that participated to come back and ask if they're okay with that portrayal. So
Completely agree.
Right.
no offense to
No,
Andrew.
actually, fair enough. And, you know, Andrew, I appreciate you being okay with that because efficiency. So, okay, cool beans.
All right. So the list of changes I have, change Mr. Joe, as listed in the beginning there, to Mr. LaPointe. Oh my gosh, my handwriting's horrible. Contamination standard rather than contamination level, that needs to be adjusted. It should have been listed as COVID-19 safety measures, plural. Jennifer Mccloud mentioned about mental health, amend to include that concern. Melissa asked Rayla Campbell's address. Second should be singular, not seconds. The Board of Health Facebook page discussion is not included. That should be included as well. And the chair recognizes Alex and Allison. I'll amend that to include the Melissa asking for that. Okay, and that's all I have. Anything I missed?
I'll make a motion to approve December 6th minutes as amended.
I'll second the motion.
A motion to approve December 6 minutes as amended by Kevin, seconded by Christina. Any discussion? Take a roll call vote. Start with
Sorry,
Andrew.
Aaron.
Yeah.
I'm a little hesitant just because of the Facebook discussion not being included. I'd like to table that until we see the final version of the minutes, just because that's a significant section that's missing. I want to make sure it's worded correctly.
I have a motion on the floor, so we have to act on that motion first. And if that motion does not pass, then we can take out the table. Any other discussion before we vote? Andrew, how do you vote?
No.
Melissa?
No.
Kevin?
Yes.
Christina?
No.
And I vote no. The motion does not pass. Do I have any other motions on this minute, on these minutes?
Yes, I have a question for the chair. Is it possible for those specific minutes for us to do that offline? For example, Aaron, is it possible for you to make that amendment for the Facebook section, send it out to the board, and we can vote on it through email, or does it have to be at a board?
It should be in person. I don't feel comfortable for us taking votes offline, even if
I
it
understand.
is
All right.
logistical. Do I have any motions on these minutes? I will make a motion to table these minutes until our next meeting, so that we can include the Board of Health Facebook page discussion.
Second.
Second from Andrew. Any discussion? We're gonna do a roll call vote. Andrew, how do you vote?
Yay.
Melissa?
Yes.
Kevin?
Yes.
Christina?
Yes.
And I vote yes. The motion passed unanimously, so we'll bring this back up next meeting. All right, Andrew, these are the last ones with that you were a board member on, is the 20th. These ones are only 2 pages, so it's half the amount. Okay. I want to make a note. I believe these things were highlighted. I am not personally a fan of highlights in our minutes, so it's something I'm going to try and get removed moving forward. I don't think that things should be highlighted that way.
Aaron?
Yep.
I would like the second paragraph where the highlights are. I would just like it to be very clear what Mr. Golightly is restating. For example, the note in parentheses, I'd like it to be clear that that is either from Marty and not a note from our minute taker. It's just kind of a format thing. I don't know if you want to put in quotes or just.
Okay. Yeah, we'll work to clear that up a little.
Something I just noted too, it says members present and it lists Marty Golightly as a member of the board. I think we need to make sure that that's clarified in the minutes. I apologize if I missed that in the 11:15.
Yeah, I think he was listed as a member. I think that's also why it says health director, but it looks like health director is a member for all intents and purposes. So we'll just try to clarify that a little bit.
Thank you.
Let me know when I'm good to scroll, guys.
Good to go.
Good.
I'll set it, Aaron.
I think so. I think he did. I don't know what his schedule is. Yeah. I'm so glad you did that. I know.
That's the end there. If any other changes?
There was significant discussion between Mr. King and Attorney Spara over word choice.
Okay.
Yeah.
I would believe it was the legal definition of the word incompetent.
Yeah, I'd have to go back and look at notes in the video to be able to accurately remember what I was saying. But I don't think that covers the exchange back and forth between me and her.
If I may, having that exchange is not necessarily important for minutes. We really just need the votes at the end of the day, and this is available on video. So if that's something we're not clear on and we want to just omit it for the sake of getting minutes out that reflect at least the vote taking, it's not something we have to have covered.
I do not want this omitted then. I definitely want it on record, that she also reiterates that personal liberties, her opinion is that personal liberties end when the actions of the individual may hurt another, and highlights the example.
I believe that was a reference to the definition under, the regulation that she was pointing to. I mean,
Well, if we're going to add this in, we can go back and get the exact where that was located. I don't want to speculate based off of what we may or may not remember. Especially if we have video evidence.
I personally would not like to admit that exchange going back and forth between me and her. I think we can change that up a little bit. I don't know, Aaron, maybe I can get back to you and we'll put that. Some stuff needs to get changed there. And then I don't know, that means should we table this one as well?
I was going to make a motion, and I will make that motion to table these minutes just because of the uncertainty. It might be better to look at this with a fresh pair of eyes after looking at the video again. So I'm making a motion to table the approval of this minutes until the next meeting after we review.
Second.
I have a second from Andrew. Do I have any further discussion on that? Take a roll call. Andrew?
Aye.
Melissa?
Yeah.
Yes.
Kevin?
Yes.
Christina?
yes.
And I vote yes. Okay, so we will table that till our following meeting. All right, Andrew, those are all the ones that if you need to hop, that's not a problem.
Yeah, I'm gonna bow out. Do I have to publicly state that I'm abstaining from a vote for the other three, or?
I think we will count your absence as an abstention.
Okay. Alrighty. Thank you. Have a good night.
Yeah. Thank you, Andrew. All right. Moving on. So we still have the 20th of September, October 4th, October 18th, and November 1st. Two of these are 1 pages and the other two are 2 pages. So moving on to September 20th, 2021. This is that day.
So again, we should make a distinction between members and health department members.
Melissa, I'm going to make that a note for all of them, so that way you don't have to keep repeating yourself. I'll make that a note so that way it gets taken care of.
This one is a little muddy though, because Chris was resigning, and
yeah, I believe
I'm not sure where the line is for
that. I
that.
think was submitted before the meeting, anyways. So I think you're right. It should be separate here, anyways.
Okay.
Can we just change the phrasing from Chris to Mr. Schultz?
Yep.
I'm good.
I'm just going to scroll now.
Should be Mr. Rojas. It says Joe concerned mask mandate is on every agenda. And then
I'm going to scroll now.
I'm good.
I don't remember offering to review as sources of data. Can you scroll back up, please?
I remember doing that.
I don't remember publicly saying that.
I'll go back and listen. I believe. Oh, I'm sorry. I can go back and see what exactly was said. That was why this is written down that way. We may have said something to the effect of, you're more than welcome to share those sources with us so we can review, and that may have been why it was written that way, because he was referencing something that wasn't in front of us.
And, to his credit, not like it's just for a credit for a community member, he did email me like his resources and was actually really good about that. And our health department was good about helping interpret it because it was a little bit beyond my like technical level. So I do appreciate residents who say, I'll do this, and then they follow through. It's really nice and welcomed interaction.
I have the thing with Mr. Rojas mentioned. I'm going to scroll down now, but I have that noted on the side here. Just to-
I'm not clear on if it was this interaction or not, but I asked if his ongoing stance was that he was against mask mandates.
Mr. Rojas, is that who you talking
Yeah.
about? Okay.
She was like not happy with that, right? At 7 o'clock, she was flying out of her room.
I'd like to try and get that resident's name if possible.
For that section specifically, I would at some point like it to be clear that, I mean, here's the thing. If we have a resident who comes to a board meeting and says, listen, I have access issues due to a disability, I would like that language in our minutes because documenting, that we have residents with disabilities who are expressing access issues. I just wanted to be a little bit more formal what was going on there. I know, Melissa, you interacted with this resident, so I don't want to put words in your section, but it's pretty significant,
I do want to make note though, just mentioning that he was having access issues just as a point to have in the minutes. Just I guess I'm failing to understand the correlation between having a record of this meeting and putting that in there.
Because here's what I think about it. One day when somebody, and it won't be me, comes and says, listen, the town of Abington really has an issue with people with disabilities having access to town halls and politics. I want there to be documentation about how many times these were expressed and what type of avenues. I mean, that's just kind of my thing. Do I think something like that's going to happen? I mean, not that I know of, but disability and access, it is something that on this board has been brought up before. And since I've been on this board, I don't know that there have been resources available to us as a board to actually improve on those types of things. I mean, we are at the resources of the town, for example, Zoom and what we can do and having an ALS person, that's the town's resources, not really what we have to work with. So that's why I'm bringing it up.
I don't want to go into a discussion about that issue right now, just because we're going over the minutes, but that is something I've been trying to address since this came up, and I did address with our previous health director, and I'll probably have to bring back up with our new health department.
You're right, Aaron. I apologize. I was trying to vocalize my justification for the request, like why.
Yeah, no, I asked the question and I got an answer. But
you're right. You're right. This is not the time or place, and you're right for that feedback to me.
I'll just throw one more comment in there. I know we don't want to get too heavy into an issue of policy, but I also commented on my credential of the ADA piece, since there have been some comments on Facebook about whether or not our board has qualifications to be on this board.
Yeah.
All right, I'm going to scroll down to the mask mandate section. If I need to go back up, just yell at me.
Thank you, sir. I'm good.
Okay.
For the section on Mrs. Mary, and I apologize for the name, Deschamps. Ms. Pfeiffer asked what the preferred method of communication is. I specifically asked I explained to this resident our current modes of communication, and then asked if she would like to see anything else. And at that time, she was not able to offer any feedback of preferred methods of communication. I just want the minutes to reflect that a board member detailed what our communication currently was, did request if there was any feedback to us for additional methods, and at that time, there was none.
Okay. I'm just going to scroll to this next page here.
Thank you for your diligence, Aaron.
And thank you to the 7 people still watching us go through these.
A question to yourself, Melissa. Was the event official title Pizza and Prevention? Is that the right title?
Yes. And then I believe we specifically mentioned the upcoming training that was offered immediately following that event.
Yeah, is there? Okay, yeah.
Nothing else for myself, sirs.
I'm just going to scroll down where pizza prevention is at the top here.
Sir, for on the June 16th, who is the person that was providing this for discussion?
The June 16th is referring to Governor Baker's act. So I know that was something, I think this is almost verbatim what I read.
So would it be like Mr. Christensen presents this verbatim as it was read? Otherwise, it looks like we were all discussing all these things.
I will update that to say that I had mentioned it, because this is, I think, almost all me talking here, except for at the end. No, I think it's all of it. I will listen to it and update accordingly.
Thank you, sir. I'm good with this.
I'm fine.
Should be towards the end here. I'm actually going to scroll down past that whole paragraph there.
Where it says, Ms. Pfeiffer lists the reason why Zoom meetings may be inclusive of all Abington residents, if possible, all Abington residents, and I specifically mentioned minorities. I mean, I want it on the record that myself representing our board, it is a part of how we make decisions.
Okay.
That this far does not modernize basic capabilities. I'm good.
All right. So that's the end of these here. I can read off the notes I have here. Just let me know if I'm missing anything. We want to specify the members versus the staff members. Oh my gosh. Should be Mr. Schultz, not Chris. Right at the beginning, Mr. Rojas is what is his ongoing stance should have been included. And just, these are summary notes I have written down. So if I'm going to go back and watch the video if I miss anything as well. Resident name should have been included in one of our public comments. Access issues should be brought up. Melissa wanted to add the ADA qualification as well. The method of communication for Mary Deshawn should have been included. Upcoming training was not mentioned in the debrief of the pizza and prevention event. That should be added. Should say Mr. Christian right before June 16th, that discussion, and minority access to meetings due to the Zoom should have been included as well. Does that somewhat summarize that? Anything I'm missing? Anything else we need to add?
Yes, I'd like to make a motion to table it until updated.
I have a motion to table until updated. Do I have a second?
I'll second the motion.
Second from Christina. Any further discussion? We'll take a roll call. Kevin, how do you vote?
Aye. Yes.
Melissa?
Yes.
Christina?
Yes.
And I vote yes. All right, so that's tabled. Okay. October 4th. If I can get this scroll, my apologies. And I'm making a note about the members versus staff.
Can I make a recommendation that we change the phrase in the first paragraph where it says Mr. Golightly states the death cases? That's the last sentence. Could we change that to the mortality rate? It's just a little more sensitive, and I think it's a little more correct. And thank you for that, Erin. My little healthcare background just kind of.
Not something I would have caught on to immediately. I appreciate that. Yeah, I'm going to begin to scroll. Again, just yell at me if I'm going too fast.
Last sentence. Board asks public to not leave trash out. Can we change it to board asks public to not participate in illegal dumping? And I'm done with this page, sir.
Okay.
Sometimes later into as part of the process. I'm good.
Okay. So I have members versus staff to clarify that. Change death cases to the mortality rate, and that the board asks the public to not participate in illegal dumping. Do I have a motion on these minutes?
You want a motion to, I think on something like this, the changes are pretty insignificant. I would, make a motion to approve based on the changes to, the amended changes.
I have a motion to approve as amended. Do I have a second? I do want to note, Melissa, I believe you were absent for this one, so I think you should be abstaining from this
Correct.
vote.
I will second the motion.
Okay, all right, so I have a motion from Kevin to approve as amended, second from Christina. Any further discussion? Roll call vote. Melissa? Abstain. Kevin?
Yes.
Christina?
Yes.
And I vote yes. The motion's pass. Minutes pass as amended. Okay, 2 more and they're 1-pagers, so we're getting through these. Okay, so this is October 18th.
Okay.
Go ahead, please.
Fine.
I'm good with this.
I am too. I'll make a motion to approve.
Second.
I have an motion to approve from Kevin, and Melissa, was that you that seconded?
Yes.
Okay, the only thing I'll say about discussion, we don't have to say this amendment, but I can make the amendment just clarifying the numbers for staff.
Right. Right.
But if there's any further discussion, Melissa,
Yes.
Kevin,
Yes.
Christina,
Yes.
and I vote yes. The minutes passed. Okay. And last one. This is November 1st. Thank you for bearing with us, our 7 audience viewers and everybody on the board. I know this is painful. I'm glad we're getting it done.
Go ahead, please.
Okay.
Motion to approve.
Motion
Second.
approved from Melissa, second from Kevin. Any further discussion?
1 second, kindly. Yep, no discussion.
Melissa,
Yes.
Kevin,
Yes.
Christina,
Yes.
I vote yes. The minutes pass. Okay. Wonderful. Thank you. I know that was an ordeal. I'm glad it's over. That is all we have on our agenda for tonight. Do I have a motion to adjourn?
I'll make a motion to adjourn. Second.
A motion to adjourn from Melissa, second from Kevin. Melissa,
Yes.
Kevin,
Yes.
Christina,
Yes.
and I vote yes. We are adjourned at 8:06.
Thanks.